What's up everyone, this is Ethan back with a video, and today we're going to be exploring movement and anatomy in a way that will really help you if you are experiencing discomfort or even sensations of pain at the knee joint when taking your leg into positions like Padmasana, which is also called the Lotus position. So what I'll do is just give you a very fragmented sort of step-by-step approach to taking positions like Padmasana, but first I will go into some anatomical exploration just so that we're all on the same page about the knee joint, what it does and what it probably should not be asked to do. And we'll just begin by imagining that you are seated on the ground with your legs outstretched in front of you. And if you'd like to turn the toes out and back in, what you'd find is that in this position with the leg completely straight, you do not have access to that movement from the knee joint in particular, nor do you have that access from the ankle joint. So the movement will have to come from the hip. The whole upper leg rotates externally and then back in. However, what you'd find is that with the knee bent, you do have access to rotation from the knee joint, and you can actually test this on yourself by holding the upper leg in place and trying to turn the toes out and back in from there. So what this tells us is that the knee joint is not purely a hinge joint. It's actually a much more complex joint than that. It's also not really one of the big, sturdy, stable joints of the human body, so we don't really want to increase the flexibility at the knee joint. We don't want to make those ligaments and connective tissues sort of loose and soft over time in the yoga practice. We want to keep them as stable and solid as possible, so we'd be much wiser to rely on the movement of the hip, which is a big solid ball and socket joint, much more capable of developing the kind of mobility that's required for positions like Padmasana. So what we've just looked at is this movement, twisting the knee joint. Another movement that would be very wise to avoid is this, torquing the knee joint. So that's actually pulling the bones away from each other, and that's exactly what you'd get if you imagine that you were just seated on the ground, and in this example you have quite tight hips and you just reach down, kind of grab the ankle and try to force the lotus position to happen. You'd actually be changing the relationship between those two bones and torquing the knee joint. Another really good example of these movements is in Janusirsasana C, where the student tries to reach underneath and use the foot as a lever to actively twist and torque the knee joint as much as they possibly can, and then if there's anything left to be done by the hip, then that might fall into place as well. There's much more integrity to be found in the method of just closing the knee joint comfortably, doing most of the work with the hip, and then if there is any rotation still required at the knee, it's so much more likely to fall within your healthy range of movement. But back to the matter at hand, to take your leg into Padmasana, especially if you do experience some instability, a little bit of pain, the best way to do that is usually to just break down that movement into little steps. And so the 3-point entry to Padmasana is a very effective one. And what that looks like is step 1, just close the knee joint, not demanding anything from the mobility of the hip. And from this point onwards, the relationship between these two bones will not change. If you feel okay there, then moving on to step 2, opening the hip, taking the knee out to the side. So step 1 was a little bit like Marichyasana position. Step 2 is very much like Janusirsasana A. Moving on to step 3, lifting the whole structure, rotating into the mobility of the hip and placing the leg comfortably in Padmasana. After you finish the asana, you'll want to exit as safely as possible as well. So just moving from here, step 3, back to step 2, back to step 1, and then straightening the leg all the way out in front of you. If you feel very comfortable there, what you could do is a slightly more efficient version, which is the 2-step entry to Padmasana, and that would just be to combine steps 1 and 2 from the other one. So rather than taking the knee straight up and then all the way out to the side, just taking it out somewhere in between the two, so at a diagonal, closing the knee joint in a comfortable position, rotating into the mobility of the hip and placing the leg in Padmasana. Of course, all of these steps are not really the counted vinyasas of the Ashtanga Yoga sequence, so if you feel comfortable to do it all in one movement, you can go through those 2 steps quickly and effectively, placing the leg into Padmasana. So for the most part, at least in Ashtanga Yoga, it's not usually the case that once you've got your leg into that position that that's the whole pose, and some of the time going a little bit deeper and making the pose more complex can actually then start to put a little bit of pressure on the knee. So especially in the case that maybe you have to reach behind and take a bind to the big toe, if you look down and you notice that there is some space between your heel and your upper body, maybe it would be asking a little bit too much to reach behind and take the bind. So a very easy modification would be to just skip the bind for now. However, if you do notice that the heel is nice and nestled on the inside of the hip, then what you can do is turn the chest towards the lotus leg, reach behind, catch the toe with all fingers, square the chest back towards the front of the room, and continue the posture from there. And that same kind of theory can be applied for postures like Marichyasana B, Marichyasana D, where you might feel fine taking the leg into lotus, but then by the time you tighten it up and lock in and take the bind that's required for that pose, then maybe you start to feel it in the knee. Best would be to just slightly back off from there to the point that you're not feeling that discomfort in the knee. With all that being said, I'm not really a big fan of the idea that if you can't close the knee joint and you can't take a nice clean Padmasana position, that you just kind of pull it in as close as you can and hope for the best. Much better would be that the student knows, okay, I'm either doing the full version of the posture or I'm using a modification for the posture. And so there are some very, very effective modifications that can be used for these poses that I'll probably make a video about and post it in the next couple of days, just so you know what to do if you aren't going to be doing the full version of these poses. However, if you are totally comfortable with taking one leg into Padmasana and you're ready to take the full version of Padmasana, then take the first leg in, the right leg, by the preferred technique, and then when it's time to take the second leg, just relax the left leg out to the side, take the knee out wide, close the knee joint in as comfortable a position as possible, and usually you'll have a bit more access to taking the left foot on top if you cross at the ankles, and then potentially just squeeze the knees together and make your Padmasana a little bit tighter from there if you feel comfortable to do so. It is also technically possible to do the 3-point entry with the left leg, but that's kind of not very efficient. It's kind of going through Marichyasana B position and then taking it out to the side and moving it in. It's also not really accessible for all students, but you could have a play around with that and see if that works well for you. So just to kind of round everything off, I'd like to encourage you to just exercise a great deal of patience on your journey towards doing full Padmasana. This pose is really seen as one of the holy grail positions in yoga in general. Like, everyone who's gone to a yoga class wants to be seen doing Padmasana, and it's just not accessible to all students all the time. It's really one that comes as a result of your long-term practice of other asanas as well, and just developing the openness of the hips and the stability in the knees that is required to do a posture like this. I really don't think the full version of Padmasana is a pose that has a very favorable stimulus to fatigue ratio, and what I mean by that is that the stimulus that this pose provides to encourage your body to change and adapt and become comfortable in this pose is very low compared to the amount of fatigue that your joints and connective tissues take from sitting in this pose if you're not really ready for it yet. So much better would be to just work into it over the long term by using the other asanas and by using modified forms of this asana that have a much better stimulus to fatigue ratio. As I said, I will make another video about that and I'll post it very soon. So subscribe to this channel for more videos, and then I'll see you in the next one.